Hello, I'm Maria Hall Brown, and this is LA Currents. Well, the last 2 years have been filled with questions, concerns, adjustments, but fortunately, we've learned a lot as well. Today, I'm delighted to be joined by Dr. Laura Kokinda, psychologist, and Joanne O'Brien, Medical Services Administration from LA Emergency Management. You guys have just been such a solid source for great information for the last couple of years, and I'm delighted to have you both here today because there are some things that we should really be paying attention to now that we're at this stage of the game. So thanks for being here.
Thanks for having us. It's good to be back.
We are in a position now physically where we sort of have a handle on what we should be doing in order to protect ourselves from COVID-19. But things change and variants are on the horizon and mask mandates are being lifted and things like that. So Joanne, what should we still be aware of and what should we be doing?
Well, keep in mind that with the BA2, which is the new variant, that a rise in cases is expected because this particular variant is 50 to 60% more transmissible, which means you can catch it easier than the last variant. But we have vaccines now, so the world's a little bit different. So if you're vaccinated, fully vaccinated, and you're boosted, your life is okay. You can go to a bar, you can go out shopping, you can go to a party, you can go to a concert. I would, however, if you're in a crowded place, I would still wear a mask because we know that the vaccine doesn't prevent infection. What it does is it prevents you from getting severely ill. You're not going to end up in the hospital or really sick, but you might get a little sick. So if you want to be 100%, get your vaccination, get your booster, and wear your mask when you're out in a crowded place.
We keep hearing about these variants that are more transmissible, more transmissible, more transmissible. It's almost as each one has been, Delta to Omicron to now this one is entitled what again?
BA2.
BA2. What does that mean exactly? It's just, it replicates faster, it moves faster, your body absorbs it. What is it that it means it's more transmissible?
All of the above. It means that if I'm standing next to you and you happen to be infected, and when you exhale, it's kind of airborne. It's in the droplets of your saliva, and I breathe it in. It takes less of that virus to make you ill.
Oh, interesting.
So it just hooks on, and once it gets into your system, it can duplicate a whole lot faster. And so when you have more of what we call a viral load, you will become ill.
Okay. But with the vaccines, et cetera, that the body's capacity to stop you from getting critically ill has been really impacted in a good way.
Absolutely. We know that to be true. If you're vaccinated, you're almost 100% not going to be in the hospital or get a really severe illness.
Okay. All right. So along the physical issues that we've been dealing with, Dr. Kokinda, we've talked a lot about the mental things that have happened. What have you seen over the course of, changing into this new, more open world? What kind of mental concerns should we be aware of?
It's very similar to what we were seeing before. It's just more change. A lot of us finally got comfortable, even with things we didn't like, just being aware of the dangers, wearing our mask, doing those things. And now suddenly people aren't wearing masks, you can go places, and as much as we've waited for that, it's a new change, and old habits die hard. So a lot of people are having the same kind of thing. They're having reactions to being able to go places that brings anxiety, or maybe wondering, when am I going to go back to my office? Or am I going to have to return to my workplace? I've set my schedule where I'm home now, and all of that brings new challenges.
That's one of the things that we created for our children when they were growing up, these boundaries in which routine becomes a security blanket and the child is able to grow because of that feeling of security. So as an adult, how long does it take you to create a routine that allows you to feel secure?
It takes a few weeks to get started, to feel used to it, and then it can take, a few months, up to even 6 months, depending on how much has changed.
Okay, so now we've had 6 months of being at home, actually, 3 times that, and now going back into the office. There's obviously going to be stress related to that.
There is, and there's stress for everyone because even the individuals who have continued to be at the office or be at the workplace, there's a lot of people who couldn't work from home. They now have people coming back into the office who are edgy. They're edgy because they haven't had to deal with, people in their space. So there's a whole new world of challenges coming from normalizing.
So what should we be aware of? How can you detect stress in somebody? How can you tell if I'm stressed?
Well, right now, I think if we look at anyone, just assume they're stressed. That's sort of a good rule of thumb for dealing with this time. I think back when I was leading some therapy groups, a good example we used to use was if you're walking down the street and if somebody is kind of on their phone and bumps into you or gets into your space, that's really flustering. And instead of thinking, oh, what a rude person, they bumped into me, which is what we tend to do, and just assign these negative qualities, think, I bet they have something going on. Maybe they are getting bad news or something just came up, and give them a pass on that one. And that's something that we should all be doing now. So everyone's a bit stressed no matter who you are, new changes, routines. So let's try to give each other a break while we get used to it together.
Never make assumptions.
Mm-hmm.
All right, so we've learned a lot about the virus. We've talked from the very beginning. I remember the very, very, very first time we had the opportunity to speak. We were worried about how long is it going to stay on surfaces? How is it going to get transmitted? Now we know that it is airborne. But what about that whole thing of sanitizing everything we come in contact with? Have we learned that it's not living on things anymore?
Right. It can. It's not likely. That's not how it's really transmitted. But, and I'm making this up, say somebody sneezes all over, they don't cover their mouth, and then maybe you put your hand on that and you rub your eye, you potentially expose yourself to that virus. So theoretically, so we need to always wash our hands, high touch surface areas, doorknobs, things like that, light switches, things like that people touch a lot. You might think about wiping off, sort of routinely. It doesn't hurt.
Because you don't know how long it's been since somebody may or may not have. Okay,
Right.
So let's go back to this whole thing. Now we're into this transition thing, and everybody's kind of feeling their way back into it. How about shaking hands?
Dr. Fauci said he hopes that never comes back.
But it's coming back.
Yeah, and he said, because gosh, it helped with the flu, the influenza. And even if it is coming back, you're right, people, when we go out, but you still sort of should wash your hands, maybe not in front of them, like, be back, but it's probably not a good idea still. We still have it out there. It's really not sort of, in terms of hygiene, you should always wash your hands after you've touched somebody else's hands.
And along those lines, the things that we have sort of incorporated into our daily routine, washing hands being one of them, are we always going to be singing happy birthday twice? Is that a good idea no matter what?
It is a good idea no matter what, because, we still have influenza, there's still other infectious things out there, and it's, in a restroom, everything, you should always do the happy birthday.
So you brought up, the clinical part of it. Now there's someone just extended their hand to you and you're not comfortable. Everybody's at different phases of this. I think that's the one thing. We all kind of did one thing because we were, rallied into that particular. But now everybody has their different modalities. Everybody has their different comfort levels. And now everybody is handling it differently. So how should we handle something if somebody extends their hand and I don't want to touch them? Or, how can we walk this compassion line when it comes to people's comfort level with whatever it is that we are currently handling when it comes to this virus?
Well, one thing, we all need to recognize everyone's at a different comfort level. We can't make assumptions because those will get us into trouble. But if someone does extend a hand or something else you're not comfortable with, let them know. You don't have to aggressively let them know. You can make a joke like, oh, I'm not there yet, or anything along those lines to kind of diffuse that situation. Give them a heads up what your comfort level is, and then hopefully they receive appropriately.
Have we become better communicators, do you think, during this? Are you noticing that people are more willing to express themselves in terms of how they're feeling versus prior to the pandemic?
That's a great question. I think in certain ways, yes. A lot of people are very expressive about their feelings and thoughts and opinions. I think something, though, is we need to make sure that that crosses groups. So it's not just with those who we feel share the same thoughts and opinions and feelings. We want to be able to communicate to people who might feel or think differently as well.
Yeah, because this whole thing, I mean, just even before we started, rolling the cameras, we were talking about our different experiences going out in a group. And, there are some odd things I don't think any of us anticipated stepping back into the world. It's like, oh, this crowd's too big for me. Or, oh, why don't they have their masks on? Or, oh, where am I going to sit at the restaurant? There's lots of this that we'd not even considered in our hopes that we would just be past it all. So how do we handle that personally? How do we, not only are we helping others, but how do we help ourselves?
Cut yourself some slack. You're not going to know how you feel in certain situations until you experience them. We might think we know, and we could very possibly be right in our predictions, but we may not, and that's okay. If you go somewhere and you recognize, I don't feel safe, or this doesn't feel right for me, pay attention to that instinct and go ahead and go home. Go leave a little early, communicate what you need to, and just communicate to your friends, family. They'll understand.
How do you sense that in yourself? What are some of the warning signals that you are, that you are responding to something in a way that you may not have recognized?
One way to really pay attention is our body. We start to tense our shoulders, we tighten up our muscles, maybe our jaw gets a little clenched. All of those things are really good to pay attention to. Heart rate might speed up, lots of discomfort and anxiety we recognize physically before we can put a name to that emotion.
I think there is also that issue of, there are those of us that have been perfectly fine through this whole thing. In terms of work has been supportive, family's been supportive, we've not necessarily dealt with any kind of direct trauma, and yet we still feel bad. Why is that happening?
There's a lot going on in the world right now. And so it's really hard to be someone who's not had anything touch your life. Even just the changes of the way people are doing things, it all brings change, which is stressful. But also, we've seen a lot of behavioral changes in society in general. And that puts us on edge. It makes things a little more challenging to navigate the world the way that we used to.
It doesn't seem like it's going to end because we're talking about the virus because that's your area of expertise. But you're right. The whole world just seems to have, whether it's just financial inflation, whether it's the war overseas, whether it's, whatever trauma is happening in cities and different places around us, it doesn't seem to be abating. Are we in trouble psychologically? We should be doing things proactively as well as reactively?
Yes, we should, actually. One thing is taking care of our physical health first and foremost, eating well, sleeping well, maintaining social support, nourishing those healthy relationships, and also checking in with ourselves. Look inward, see how you're feeling. It's really easy to push through these bad feelings and kind of ignore them because they're difficult to deal with, but see what's going on inside and if we need to reach out for help.
Well, along with the mental, there's the physical in terms of help. We have the vaccines now, and the vaccines have been successful because there's less people dying, correct?
Correct, yes.
Because I know the statistics of 2021 were pretty horrific. But now there's this whole issue of boosters, and along with vaccine hesitancy to begin with, is there a thing that's called booster hesitancy?
Yes, in fact, I read some statistics that 50% of the population that is eligible to receive a booster has not gotten it. And it's because I don't need it, I'm okay, I haven't gotten sick, I had side effects. And we know now that the antibodies for the vaccine will go down. They'll wane after about 4 months. And every month it'll go down some more, which is normal. Our body has lots of antibodies in there, and we're exposed to a lot of things, and our body will make antibodies. We can't have all those in there clogging up all the time, so that's sort of a normal mechanism. So, and like, there are a lot of vaccines out there that you have to get a booster. Like tetanus is one of them. They don't last forever. Hepatitis B, there's a bunch of them where you have to go and get them again. So, those people may get exposed to the BA2 and get sick. They may get sicker than if they got the booster. So Yeah, get the booster. It's out there. The side effects really aren't even measurable to getting COVID. You know, they're transient, last a day. You might feel a little achy, a headache, but it's nothing.
Are we always going to be in a situation of getting a booster? I mean, what is on the horizon? Because I know that there's the rapid nature of how science has risen to this call has been pretty profound in a lot of different ways. But are we all going to have a booster, or is there going to be a vaccine on the horizon that's going to just, cover you for as long as you need?
Yeah, I think the research is still out there. I know they're looking at in the fall, just as they recommend for the flu vaccine every year, to get a vaccine for COVID. There is research being done right now that is tweaking the vaccine to actually be a little stronger, and not just what it did is kind of the spikes on that was the part they were sort of manipulating with the vaccine to actually get on the inside of that, the virus, and change the vaccine to be more effective and last longer. So that's
to fight the variants.
So we won't have to be chasing the variants all the time. They sort of get to the core of the virus. So that's what they're working on, but it's not out there yet. Yeah.
But we can pretty much assume that this is not going away.
No, not anytime soon. So if you haven't gotten the vaccine, why not? If you haven't gotten your booster, what are you waiting for?
Okay. And when it comes to vulnerable populations, are we still concerned about those that are immune compromised? Are we still concerned about the elderly? How are we faring with the little guys?
Yeah, you have to remember the vaccine is to protect you and others, and that's what's sort of been the unique thing about this virus, is that you can even have it and not have any symptoms and pass it on. And for those people that are vulnerable, they could get really, really sick and maybe die or have long-term health effects. So we need to consider that, and we also need to consider the children that can't get vaccinated yet, less than 5. We know recently in some of the school districts there's been an uptick. We do in school, and I'm talking school age, that can get vaccinated, but it's still out there and spread. So we definitely need to take care of each other, and especially the immunocompromised, people with cancer, HIV, autoimmune diseases. We need to remember them.
You're talking about, these classifications of people, and how do we recognize how a child is somehow being affected by this, emotionally? Because kids are kind of all over the map when it comes to their behavior anyway. But what are the things that a parent, a teacher, a colleague, whomever is around children should be aware of when it comes to children and this problem?
I think a good thing to keep in mind is that children are like sponges. They learn, they sense everything. So if we are very anxious or kind of exuding a lot of these emotions, they're likely to pick that up. And that doesn't make it easy as the parents, teachers, adults, because there's a lot that might make us feel that way right now. But it's good to keep that in mind because the children are very sensitive to taking that on themselves.
So how do we, if we see a child in stress, what's the best thing to do? Acknowledge it, or distract them, or
speak with them. Speak as openly as you can based on developmental level. Kids, they want to learn, they want to know. You got to judge based on the maturity and the age of the child, but definitely ask them how they're doing. Let them know they're going to be okay, and have those open conversations.
Do we think we've caused emotional harm to our teenagers and our children through this whole thing because of all this trauma? Is there a general consensus that that's actually happened? Because I've heard it both ways. That resilience is one thing, but trauma is trauma.
There have been a lot of events that have been traumatic for individuals. People have lost family members. People have seen other negative consequences, and trauma is trauma. That being said, we can take this as an opportunity to teach our kids and teach our teens about resilience, about coping skills, and let them know everyone's going through this together. And the research has shown there has been an uptick in some mental health concerns in kids and teens, but that doesn't mean that we can't take it as an opportunity to do better for them.
Because I've also, we're talking about the mask mandates and everything, that there are some young adults, middle school in particular, that want to wear the masks as it's become a safety net of some kind. It's kind of a place to hide. It's, and they don't want to take the masks off because, it's a very hypersensitive time in your life when you're super aware of your appearance and how you behave and everything. And that they're using them almost as a face blankie. Is that a okay thing?
We want to meet the kids where they're at. You don't want to push them to do something they're not comfortable with, but also start that conversation. And if you notice there is a big uptick in anxiety, or your child or loved one seems a little more anxious than is reasonable, see if they need some additional support. There's a lot of good resources, and that's a good lead-in to have them get some help.
Where are all those resources? What are they? Because it seems like there's a lot of apps now. There's a lot of apps that are based on stress. There's a lot of, we're supposed to all have this telehealth. But, what are these things? What's out there now that maybe wasn't out there even before March of 2020?
There's apps for mindfulness, for coping skills, to coach us through these things. There's telehealth, so you can meet with a therapist or counselor from your home. You can also now go back in person. A lot of people are seeing people in the office again, which is another good resource. And schools are also a little more mindful of the impact of all this on the children. So they're reaching out, providing resources as well.
What kind of advances are we doing, say you are sick? I mean, I know besides, the prevention, there are a lot of medical advances in terms of managing the illness if someone does in fact get it. Is that true?
That is true. We have an antiviral medication that's approved by the FDA, and we also have the monoclonal antibodies. So there's actually 2 treatments now. So that's exciting. Where before we would just have to manage your symptoms.
So if somebody ends up in a situation in which they're, reasonably ill and they need to be hospitalized, should they ask for this stuff right away?
Absolutely. The sooner the better, especially for the antiviral. The first day that you have it, you should take that medication, or talk with your doctor and say, do you have this? Is this available for me?
And how are we knowing that we're really sick versus we're moderately sick? I mean, are we still looking at the temperature? Are we still looking at the ability to the oximeter is that you don't have a lot of oxygen in your blood?
As the variant changes, the symptoms are a little different, and the latest symptom to start off with is a sore throat. But any time you have a fever, a sore throat, achiness, shortness of breath, go talk to your doctor for sure. Like Dr. Kokinda was saying, we have telehealth now. Really quick to get on, a call with your provider. This is what's going on. And a lot of times they can just manage it over the phone. But I think the biggest thing too with these new variants, and even if you're vaccinated, pay attention to how you feel. And if you don't feel right, call your doctor. Get tested. Have the rapid tests at home. They're available. You can have them mailed to your house. The testing sites are everywhere. It's just really easy to get tested now, so you know what's going on.
How are we doing with the efficacy of the tests? Are we feeling confident in the results? Because, for a while there it was, there is a false positive and a false negative. I mean, but now we all have that available to us to be able to, as you mentioned, have them in your home. So how are we feeling about the tests
The thing about the tests, that even a lot of people are doing the tests at home, so we really don't know the positivity rate right now, because people aren't that sick. They might get a positive at home. This latest one, the BA2, is called the stealth for a reason. It hides, and so the test may not pick it up. So a lot of the providers in the community, if you sort of match all the symptoms of COVID, even if that PCR is negative, they're going to treat you like you have COVID, or send you at home to isolate, stay away from people.
People who have gotten ill, their long-term effects have been pretty varied and pretty dramatic. What are we seeing?
We're seeing a lot of what they call long haulers, is where people are having cognitive, or they're not able to think as clear, foggy brain. They've had lung damage, heart damage. They are fatigued all the time. So we're really still learning, and what it sort of tripped was this autoimmune response, where your body sort of, all the soldiers came out and kind of started attacking what they thought was the virus, but really having the effects on your major organs. So we really are still working through that, and I think a lot of people, their health will be changed like forever. You know, they won't ever be 100%.
So they're taking that seriously, because I know for a while there was the question of whether that was actually legitimately a physical change in your body or whether that was just a psychological.
No, it's real. You know, the tests for your heart and your lungs are showing actual damage. So, yeah.
It's a vicious thing. All right. So what are the things that we should avoid in general? Forget, you know, the issues of the virus, forget the issues. So what are some of the healthy things? You mentioned sleep well, you mentioned eat well, but what are some of the things that we should avoid? I know a lot of people say, I don't watch the news anymore. You know, you need to be informed, but so what are some of the things that you should be aware of that just add to the stress that we already have?
Watching the news, of course, and be informed, but limit it. Social media is another one. You want to be mindful of what you're taking in from your social media. A lot of people are gravitating to individuals who only think the way they do, which it triggers a certain emotional response in us, and we're losing touch that people are people. We want to try to stay connected with everyone because that's who we interact with in society. And then the other thing is we really want to avoid drugs and alcohol. You can have maybe the glass happy hour, you know, but we don't want to be using it for coping because that takes us down a very unhealthy path.
Have we found an uptick in that sort of across the board in people's coping mechanisms?
Unfortunately, we have. We've seen all different kinds of unhealthy coping, a lot of substance use and a lot of unhealthy eating, which has consequently triggered unhealthy medical conditions, and it's now we need to be aware of what we've been doing.
All right, so the most important thing is you talk about, you know, people and where they get their information, and, you know, like-minded people like to hang out, and sometimes that spins into something that could be called very unhealthy because you start rumors, and rumors beget non-facts, etc. So if somebody is really looking for accurate information regarding mental health, what do you suggest?
Go to providers, look at their credentials, look at national organizations. They're going to typically provide you with more current and unbiased information.
Okay. And then for the medical component to this, the you know, bad information propagates faster than right information. So what's the best source for the correct information? You know, can we trust the CDC? Can we trust, you know, all of these?
You can.
Okay.
Yeah, go to the CDC, your public health department. They've done, I think, a remarkable job of keeping data updated. One of my favorite sites is Johns Hopkins University. They have tracked this data internationally from day one. And on Fridays, they have the actual doctors doing the research that give an update. It's just great, you know, and they have slides. And just go to that site and you can kind of get a sense of what's going on everywhere. It's good.
But okay, so Johns Hopkins and
CDC, the local health departments, LA County site is really informative. It's very good.
Okay. And you both are incredibly informative, and thank you for your consistency and your great information that you've been providing through this, albeit endless scenario of stressful times. So thank you both very, very much.
Thank you.
Thank you.
And that's a wrap on this LA Currents.